Hello, it's Dr. Rhonda Johnson. Today is Monday, April 11th, 2022. And today my message is to think about the shared air. Now, we're seeing the rise of Omicron BA2 in the United States. So please think about the air that you're sharing, the air that you're breathing when you're in indoor spaces with other people. Remember, COVID-19 is primarily an airborne infection. Yes, it can be transmitted by close contact with people who are sneezing, coughing, yelling, and singing. That's called droplets, air droplets. And it can also rarely be transmitted through contact of surfaces that are infected. But it's highly transmissible in very tiny particles that move throughout the air. That's called airborne transmission that get inhaled into your lungs. So with a highly contagious airborne virus such as Omicron BA2, infections can occur even if you are physically distancing. So it's time, folks, if you've put aside those masks, you may want to bring them back out again and wear that high quality mask such as N95 or KN94, and also think about ventilation and your shared air quality. Know these things reduce the air quality if you're inside a closed space, if the number of people in the room that you're sharing the air with is high, if people aren't masked, and if there's little air movement or the air isn't filtered. Also think about your duration of exposure. The longer you stay in that contaminated shared air, the more likely you are to be exposed. So if possible, whenever possible, open those windows, get that air moving, and do more social activities outside. And although many people, experts say that it's almost impossible to avoid exposure to Omicron, it may be possible for you to minimize the dose of the virus that you inhale. Remember, the virus is here, there, and everywhere, and it's highly contagious. So try to protect yourself, protect your loved ones, especially if they're high risk. And remember that vaccines and booster doses can greatly increase your odds of staying out of the hospital if you get sickened with this virus, and greatly decrease your chance of dying. That's my message today. As always, my views are my own.